Well, let's just go ahead and get started in the interest of time. Thanks everybody for joining. Today we have Dr. Gretchen Winter, an assistant professor with the UAB Division of Pulmonary Allergy and Critical Care. She'll be discussing her time volunteering in New York City and her experience treating patients with COVID-19. Just a reminder that we'll have this video recording available shortly after this interview. So, Dr. Winter, we'll just open it up to questions. Malik or Anthony, it looks like if you have any questions to add, we'll start with you. If not, I can ask some of these previously submitted questions. Actually, somebody else is joining.
Yeah, I guess just to start, before we get into what your experience was like, can we just get an understanding of the timeline of things, when you went, how long you were there, all of that?
Absolutely. So I first looked into going when things were getting really bad in New York, but I was still needed here. And that was, I want to say, late March, early April. And so I stayed here, worked some shifts in RICU, and then things calmed down just a little bit here. And they thought that things were hopefully stabilized and reached back out and said that if I was still interested, I could go. And that was around like April 20th, I think. And within, I think that was like a Thursday, and by Monday I was in New York. And I was there for 5 weeks, and I actually got back about a month ago. So.
And how long have you been with UAB, and what's your history with the hospital?
I actually moved down here almost a year ago to take a job with UAB at the hospital, and I work as an assistant professor in the Department of Medicine. Before that, I was completing my fellowship in pulmonary and critical care medicine at the Cleveland Clinic in Cleveland, Ohio.
And when you got to New York, what was your expectation of what you'd be walking into, and what did you actually see?
So, I knew it was bad. I had friends who were there. I had friends who were there locally. I had other friends who were volunteering from other institutions. And then there was the media coverage. So I knew it was going to be bad. I knew it would be busy. I knew the hospital would be full. I knew that most of my patients, if not all of them, would have COVID. I think what surprised me was what a personal toll it took on me going in. It was busy. It was stressful. The patients were very sick, but just dealing with that day after day and having to make decisions based on resources and wonder, do we have enough dialysis machines for this? And the ventilator that this patient's on isn't designed to be used in a hospital, so I don't know how to do this functionality that I need. Things like that, I think, were the most surprising going in, is having to make decisions that I had never had to make using a lack of technology and resources that I hadn't had to deal with before.
And being there, what was it like with PPEs and shortages and concerns of that nature?
So when it comes to personal protective equipment, or PPE, there are a variety of types. Most of my friends who work in New York were wearing goggles under their face masks. I tried to find goggles for a while before I left and was unable to. So I just wore a face mask, regular masks, and gowns when I went into rooms. Thankfully, the hospital I was at said they had received a ton of donations, so they were equipped and we never ran out of gowns or anything. However, when it comes to N95 masks, which are the type that protect the wearer and filter out about 95% of particles, including COVID particles, those have to be specially fitted to your face in order to make sure they work. If they're too loose or they gape in places, they're ineffective. And the main type don't fit me well. They leak. And so I need a special type, and they did run out of that type while I was there. And so for the last week or two, I was reusing the same mask for quite a while and trying to make it tight and everything to be as safe as possible. But it is what it is.
What was the type of mask that you use?
It's called a duckbill N95.
Oh, okay. And what hospital were you working at?
I was at New York Presbyterian Cornell Will.
Gotcha. I don't want to hog. If anyone else wants to ask questions, feel free.
No problem. If anyone else has a question, please feel free to unmute your line. If not, I'll go ahead and ask one question before someone else comes in. This is from Stephen with ABC 3340. What is one memory from being in the epicenter of the pandemic that will stay with you for the rest of your life?
Unfortunately, I don't think many of the memories that are sticking are the happy ones. One I remember was a very young patient in his 30s, about my age, with no health conditions. And he had been on my service for a couple of days on maximum oxygen support that we can provide without a ventilator, and was not doing well. He was breathing very fast and his oxygen levels were low. And I realized that I needed to put him on a ventilator. And I knew that when I did, there was a very good chance he would never come off of the ventilator. So we called his wife and FaceTimed her and explained the situation. And I stood there as the patient said goodbye to his wife and his kids over FaceTime on a phone, knowing that he may never see them again. All the while I'm trying to prepare to put in a breathing tube. And it was really humbling to have to do that over FaceTime and to know the statistics on how unlikely it was that he would ultimately ever get that tube out and be able to talk to his family again.
Can you tell us what happened with this man?
Well, after several weeks when I left, he was doing better. He spent a lot of time very critically ill on maximum support, but he was weaning from the ventilator, still needing it, but needing less support on it. So I am optimistic that he'll do well.
Can you talk about I know Dr. Marazzo, I believe, said a couple of days ago, until you see somebody on a ventilator, you really don't know how bad it is or can be for them. Can you kind of talk about that?
So what you see on Grey's Anatomy, as much as I love that show, is not accurate. Breathing tubes are incredibly intrusive. If you can imagine someone doing just a strep throat test on you and just sticking a swab in the back of your throat and how uncomfortable that is. Now imagine having a tube 10 times the size of that swab shoved not only in the back of your throat, but all the way down into your lungs. And additionally, a breathing machine pushes air into your lungs. And that's not the way our lungs are designed to work. Our lungs are designed to pull air in as we expand our chest with our muscles and our effort and our diaphragm. And you're basically forcing air in the opposite direction when you use a ventilator, and that's not comfortable for patients. So they often look uncomfortable because they are, either from the breathing tube or the action of the ventilator. We have to sedate them very frequently in order to keep them calm enough that they don't injure themselves when they're on the ventilator. And then in order to monitor blood pressure and give necessary medications, these patients often have multiple large IVs coming out of their neck and their groin and their arms. And if you're not prepared for that and you're not used to seeing critically ill patients hooked up to multiple forms of life support, it can be quite harrowing.
I have a question. Thank you for that. I think that a lot of people, and you're seeing this, and it's unfortunately become a one side or another, but there are people that do think this is a hoax, and you clearly saw patients who are going through this. What can you speak on, or how can you speak on just what we can do as a community to protect ourselves, our loved ones, based on what you've seen?
It's not a hoax, first of all. It wasn't a hoax in New York City, and it's not a hoax here. I have patients dying here of COVID, and will unfortunately probably have many more. This is a pandemic. It is very real, and it's not going away. Sorry about that. It's not going away anytime soon. The best things that we can do to protect ourselves, we already know. They've already been told to us. Unfortunately, the pandemic has become politicized, which no global health crisis should be. But the simple truth is what we've already been told. Wearing a mask over your nose and your mouth helps to protect the particles that are in your breathing system from getting out into the general environment. That regular mask does not protect you a great deal, although it does provide some protection for you. More importantly, it protects the people around you. What we are finding is a large portion of people spreading COVID to others do not have symptoms at all or do not have them yet. So if we only tell people who feel ill to stay home and to wear masks, then we're still going to have a great deal of spread of this virus. But if everyone wore a mask all of the time when they're in public, the majority of those particles would be trapped in the droplets on the inside of that mask, and would not be transmitted to other people and would very significantly cut down on spread. In addition to that, general social distancing measures need to be continued. We should stay 6 feet away from all people who are not close household contacts of ours. We should minimize going out. Don't send more than one person to the store if that's not necessary. Try to get takeout from restaurants rather than sitting inside. Avoid large public crowds. All the things we've been talking about for months. But I think it's really important to realize that there is science and evidence behind the efficacy of universal masking, meaning that everyone wears masks, that it is not effective if only a tiny portion of the population is doing it. So it really is something that we have to band together to do as a community to protect each other. Whether we're healthy, whether we're not healthy, whether we feel great or not, everyone should be in a mask when out and about. And it's also very important to realize that science does not support a lot of these claims that people are making, that wearing a mask for prolonged periods of time can cause fungal or bacterial pneumonia, that it significantly decreases your oxygen levels or raises your carbon dioxide levels. Those things are simply not accurate and not medically true, and they are being used as an excuse to prevent something that is life-saving.
That's great. Before Savannah asks another question, I just wanted to go back to something you mentioned earlier. You said that your experience up in New York, obviously it took a physical and mental toll. Can you kind of weigh in on how this, I guess, can, what I'm trying to say is, what is the mental strain on healthcare workers during this pandemic from your experience?
So I can only speak from my experience and from talking to my colleagues, but we're working longer hours than we were meant to work, more shifts than we were meant to work, with more patients who are more ill. In addition to that, we're fearful for our own health all of the time. We're fearful that we may contract the virus, and even if we do fine with it, may take it home to someone else who may not do well themselves, or may pass it on to someone else who may not. We are fearful that we don't have adequate protection when we're reusing personal protective equipment. And in addition to that, just the tremendous loss, the repetitive loss of life, of function. Many of these patients who are surviving are not going to survive at the state that they were before. They will spend months in rehab facilities. They may be chronically on ventilators. They may have chronic lung issues and weakness and PTSD and delirium from their time in the ICU. And these are very real losses that these patients are experiencing. And to see it on such a large scale, day after day, really takes a toll on you mentally and emotionally, aside from the physical toll of wearing multiple masks and gowns and working long hours and many, many shifts. And it's a lot. And then there's the emotional burden of seeing your patients alone. The things that we typically do in an ICU to help people, to keep them oriented, to protect against delirium, are having their loved ones at bedside to reorient them, to remind them who they are and where they are. That's how we communicate with the families, to keep them updated and involved, and they can see the patient in front of them and we can explain what's going on. And not having those people at bedside is not only not ideal for the patient, it's not ideal for the loved ones. They struggle with that. They're fearful that they don't know what's going on and they can't see it on a day-to-day and moment-to-moment basis because they're away without a video, without a camera, and they can't be hooked in 100% of the time. And that adds to their stress. So then the relationships that we have with family members and loved ones have an additional layer of stress, not to mention the complexities of being through phones and video cams. So there's just so many layers of physical and emotional and mental.
I think you got muted, Dr. Winter.
Okay, I'm so sorry about that. What did you hear me say?
It just cut off when you were talking about the emotional and mental stresses family members are facing.
So the family members are having their own emotional and mental trauma of not being able to be present and see in real time what's happening to their loved ones, to comfort them, to hold their hands. It creates a more complex dynamic for us in trying to communicate with these family members when they're not at bedside, where we can show them how things are working and what's going on. So there's more complexity in the relationships that we have with patients, with their family members, with the trauma that we see both the patients and the loved ones going through, not to mention our own physical trauma from working the long shifts and the uncomfortable and restrictive PPE, from the emotional trauma and mental trauma that we go through, seeing so much repetitive loss of life and function and love. And it's definitely taken a toll on me. I know it's taking a toll on others. And I'm hopeful that we will still have a functioning healthcare system when this is all over, with people practicing who still have a passion for it, because I think it's really going to exacerbate the already huge problem of burnout in providers.
How would you decompress at the end of these? I mean, I'm sure every day was hard, but especially the difficult ones where, you know, you're losing patients and FaceTiming loved ones.
So I would say that would actually be one of the hardest parts of my time in New York, because there really wasn't a way to decompress in the typical ways I do. In Alabama, I have my piano and I can sit down and play. I have my loved ones that I can chat with and hang out with. And I have my pets that I can sit down and pet or walk. And I have my spin bike that I can get on and really work out that aggression. I didn't have any of those things in Alabama. I had a hotel room by myself. So, and I had very few hours before I'd be back at the hospital. So every day it was home, shower off the COVID, eat some food, do 10 minutes yoga, and crawl in bed. It was repetitive, lonely, and exhausting.
I have a question kind of on a little bit more of a positive note, and I appreciate you. I know we all do, sharing how raw your experience was. I've heard some other doctors at UAB talk about how this is, you know, you all prepare for things and you go into medicine for a reason. You know, it's a calling for most. Can you just talk about how this has reaffirmed that being in medicine and being in physician is what you were meant to do? Can you just kind of talk about the positive side of this?
Yeah. So I just recently graduated fellowship about a year ago. So I trained for 17 years total, but I am a new still staff, a faculty doctor. And I remember when I was deciding to go to New York, calling my mom, and I'm on the phone crying with her. And I'm saying, I'm so scared. And I know you don't want me to go because you're scared, but I feel like this is something that I was meant to do. And she said, you know, I am so scared for you and I don't want you to go, but I understand if you need to go. And she reiterated a passage from Esther in the Bible that says, but what if you were meant for a time such as this? What if you were made to be here to do this thing at this time? And that really is kind of how it feels. The chance that I spent all of these years studying critical care medicine, to be in the place where I was at the time I was, with the skill set that I had accumulated at that time, felt like this was my purpose. It still does feel like my purpose. And even though it's hard and it's exhausting and I'm angry when I see people not wearing masks and I'm sad at the loss and all of those heavy emotions, there is a greater sense of purpose and fulfillment, and that I'm doing what I was meant to do. And I'm going to save the lives I can and help the loved ones of the people I can't save through that loss to the best that I can. And I think that at the end of the day, I am grateful for this opportunity to serve, as hard as it may be personally, but I do feel like I was meant for this.
Thank you.
Great. Are there any other questions?
Just one more. Just how are you taking all that you've seen and learned and experienced in New York and applying it to your job in Alabama as we see cases continuing to rise here?
So COVID is COVID. It acts differently in different people, but for the most part, it is protect the body and try to give it time to heal, and do the support measures that you have to give a patient time to make it through it as much as you're able to. And the same things that I saw in New York City, I'm seeing in my patients here. I think the biggest things that I took away from that experience outside of just medical care of COVID is New York's response to the pandemic. You didn't walk on the street and see people walking around without masks regularly. Everyone was wearing masks. everyone was staying home. If you had to pee and you were in a park, good luck, because there was nothing open and anywhere to stop. So I think that that was effective in slowing down the curve and giving people time to accommodate and build a response to this virus. And that is part of why I am so vehemently advocating for adequate social distancing and universal masking here locally, because I do believe that it is the only thing that will slow the spread and help us to avoid the disaster that we saw there and that we're already starting to see here. The other big thing that I took away from that experience is checking in with the people around me. We saw so many people struggling, whether it's the patients or their loved ones, or my nurse, my respiratory therapist, our medical students, our residents, our fellows. And the only way to do this day after day, the only way to make it through, is to check in with each other and love on each other and be there for each other and make it okay to gripe and to whine and to cry and to laugh and to have all those emotions, but give people an outlet and a relationship to express those in. And I'm trying to take that lesson from New York and check in more frequently with the people around me here so that we can all make it through this with not only our physical health, but also our emotional health.
Perfect. I think that's a great way to end today's news availability. Just a reminder that we will make this recording available to you all probably about 10 or 15 minutes via email. We do have a couple of photos that Dr. Winter was kind enough to share with us, so we'll give you access to those as well. And if you have any other questions, please feel free to reach out to me. Dr. Winter, thank you so much, and thanks for everybody for joining in.
Thank you, guys.
Thank you, everyone.